A simple guide to lowering blood pressure. So your doctor just told you your blood pressure is a little high. After that first wave of worry, you're probably thinking, okay, what now? It can feel like a huge, overwhelming problem. But what if I told you that getting your numbers in check isn't about some crazy diet or a punishing workout plan? In this video, I'm going to walk you through a few simple, easy habits you can start today to lower your blood pressure and protect your health, one small step at a time. Before we get to the how, let's quickly talk about why this is so important. Imagine your blood vessels are like a set of garden hoses. Your blood pressure is just the force of blood pushing against the walls of those hoses. When that pressure is always cranked up too high, it's like running water at full blast, 24/7. It puts a ton of strain on the hoses, and eventually they start to wear out. Over time, that constant pressure can damage your arteries, your heart, and even your kidneys. But here's the really good news. Your body wants to heal, and making small, consistent changes can make a world of difference. You have the power to turn that pressure down. All right, let's get into the solutions. We're going to break this down into 5 simple, powerful habits you can start building right away. Habit 1. Discover the power of potassium. We hear a lot about cutting back on salt, and don't worry, we'll get there. But let's start with something you should add to your diet. Potassium is like sodium's natural balancing act. It helps your body get rid of excess sodium and relaxes the walls of your blood vessels. You don't need fancy supplements. Just start adding potassium-rich foods into your meals, like bananas, avocados, spinach, sweet potatoes, and beans. Now, a quick but important heads up. If you have kidney disease or are taking certain medications like ACE inhibitors or some diuretics, you need to talk to your doctor before loading up on potassium, as it could be unsafe. Habit 2. The sodium swap. Okay, now we can talk about salt. Most people eat way more sodium than they need, and it's usually not coming from the salt shaker. It's hiding in processed foods, canned soups, deli meats, frozen dinners, and even bread. Instead of trying to cut it all out at once, which is miserable, just try a simple sodium swap. Next time you're at the store, just grab one of your go-to items and check the label. See if you can find a lower sodium version. That's it. These little swaps really do add up. Habit 3. The 15-minute mindful move. Hearing that you need 150 minutes of exercise a week can sound exhausting. So let's reframe it. Can you find 15 minutes in your day for a brisk walk? That's all it takes to get started. Regular activity makes your heart stronger, so it can pump blood with less effort, which lowers the force on your arteries. But here's something you might not expect. Recent research has highlighted the surprising power of isometric exercises. That's when you hold a muscle contraction, like a plank or a wall sit. A major analysis of over 270 studies found that static exercises, like holding a wall sit for 2 minutes a few times a week, were incredibly effective for lowering blood pressure, even more so than other types of exercise in some studies. Habit 4. Master the 5-minute de-stress. Chronic stress keeps your body in fight or flight mode, which causes your blood vessels to tighten and can lead to temporary spikes in blood pressure. You can start to counteract this with a simple daily practice. For just 5 minutes, find a quiet spot, sit down, and just focus on your breath. Breathe in slowly for a count of 4, hold it for 4, and then breathe out for a count of 6. This simple act of mindful breathing helps calm your nervous system, which in turn can help your body better manage blood pressure. Habit 5. Rethink your drink. What you drink matters too. When it comes to alcohol, the science is clear that drinking too much can raise your blood pressure. While traditional guidance suggests no more than 2 drinks a day for men and 1 for women, many health organizations now emphasize that less is always better for your health. Also, keep an eye on sugary drinks. They can lead to weight gain, which is another factor that can raise blood pressure. Try this. Swap just one of those drinks, either alcohol or a sugary soda, with a glass of water each day. It's a simple change that hydrates you and cuts down on things that work against you. Looking at this list, you might feel that pressure creeping back up. Please don't. The secret is to not do everything at once. The goal here is progress, not perfection. Pick just one of these habits that feels easiest for you right now. Maybe it's just adding a banana to your breakfast or taking that 15-minute walk on your lunch break. Do that one thing until it feels normal. Then you can come back and pick another. These small daily actions create a ripple effect on your health. It's all about building a foundation of simple habits, adding potassium, swapping sodium, moving your body, breathing deeply, and rethinking your drink. You really can take back control of your health. If you found this guide helpful, please give this video a like and subscribe for more simple health tips. And let's make a commitment. In the comments below, tell us, which one habit are you going to start with today? Disclaimer: I am not a medical doctor. This video is for informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or another qualified health provider with any questions you may have regarding a medical condition. Please be especially sure to consult your doctor before increasing your potassium intake if you have kidney disease or are on certain medications. Never disregard professional medical advice or delay in seeking it because of something you have seen in this video.